looking at the rate of infections. In fact, the UNAIDS report recently reported that we have in fact seen a remarkable decline in the number of new infections, down 40% between 2009 to 2011. Do you think that as a whole, Kenya is making good strides in terms of reducing the number of infections?
Yes, I do. I think there's a huge effort from the government and NGOs, and of course the Global Fund, to really reduce the number of infections and also improve the treatment and the life expectancy of those who are actually affected.
Yep.
There's several good programs that have been put in place: HIV testing and counseling, a specific program also to reduce the mother-to-child transmission rates. There's a lot of awareness programs that are being rolled out, but most importantly, the ARVs, the antiretroviral drugs, are widely available in the country, and there are comprehensive, say, care centers where people can access those drugs and not only get the drugs, but also have access to counselors, have access to nutritionists, etc. So I think there's a lot of work is being done, yes.
Just looking at the 2009 figures, of course they have recently been updated, but back then 1.5 million people in Kenya living with HIV/AIDS. That of course is an estimate. But how has this affected the employability of people in Kenya? How would you describe the stigma attached to it, specifically in the workplace? And has it had a marked impact on the economy?
Well, what you actually see is, of course, as the number of new infections reduce and the life expectancy of the people who have HIV/AIDS increase, then the the impact on the economy actually reduces. So there's a lot of positive effects. Now, in terms of stigma, I think the stigma is reducing. It's not entirely gone, but there is, I would say, a lot of good progress being made in terms of the workplace. So what we actually see is that also because because there's so many things are improving, it also becomes an insurable risk. So as an insurance company, if a corporate wants to have health insurance, nobody is requiring to do any tests, etc. So it becomes much more a part of normal life. Fortunately, we're moving in the direction of Europe, where those people have access, and it's, like I said, an increasing number can actually make it into more of a chronic condition.
Manageable disease, and of course, a big positive there. Let's talk about the insurable risk aspect of what you were talking about, because AR Holdings recently launching the fully fledged insurance company within health services, and of course becoming an insurance player. So what does this mean about offering insurance to HIV positive people in Kenya? Is this something you are planning to do?
Well, it's actually something we're doing. We have operations in Kenya, Uganda, and Tanzania, and anybody, in terms of, if we look at specifically Kenya, where there's also a fairly large retail market, we offer pre-existing conditions for corporates, for SMEs, and for individuals. We actually cover HIV/AIDS if it develops during the course of the policy.
As you say, can almost more be classified as a chronic disease right now. So when you're looking at the cost of insuring for an HIV positive patient, how affordable is it? I mean, what can you do to make it more affordable? Is it something that you need support from, for example, a company to be able to get access to that insurance?
Well, again, what we actually do is, because there's so much work has been done by the NGOs and the government in terms of making the ARVs available at low cost. Is what we actually do is those people who we have on insurance and who are HIV positive, we put them, as we call it, on a health promotion program, which is that we just engage with the client to make sure that they get the best treatment, which is just the regular checkups, make sure that they get their drugs in time, And we do this in close cooperation with the comprehensive care centers that are there in the country.
Now, another
so actually,
yeah.
Sorry,
no, do continue. I was just going to ask you something about the health telepresence, but just finish your point there.
No, I think I finished my point. So it is, it's not a high cost. I think where it becomes a high cost is, of course, if people get hospitalized because of illnesses.
Yeah.
And that's really what we're trying to prevent from happening. And that can actually be prevented if people are on these health promotion programs.
And as I was saying, you recently launched health telepresence with Safaricom, and that, of course, an innovative step when it comes to allowing people who don't have access to medical, doctors and hospitals to get access to it. Does this mean that those living with HIV in more rural areas are going to be able to get help they need?
Well, there's a few things that we're actually testing also with Safaricom. What we see is that when it comes down to the rural areas, there are two issues. There's on the one hand, there's the access to the doctor. The doctor is far away. There are very few doctors in rural areas. So what we need to do is we need to bridge distance. And then the second thing we need to do is also try to bridge the cost barrier. We need to bring down the cost of access to health. And the reality is that most of the people in rural areas, in the lower income areas, they don't have enough money to pay for a consultation to see a doctor, because doctor salaries, as we all know, there's a continued pressure upwards in terms of their costs. So what we're trying to do is say 80% of all the cases that a GP sees could actually be handled by a clinical officer or a senior nurse, and maybe only 20% needs to be referred to a GP or maybe a specialist. So what we're trying to do with the health presence model is, on the one hand, bridge the distance, but on the other hand, try to bring down the cost, so that what we can do is offer services in areas where there are only nurses or clinical officers available, which is also something that the local population then can afford. And then if really doctor advice is required, then we can actually bring them through the telepresence into the consultation room. And this is how we can actually use the doctor's time much more effectively and useful than we've been able to do so far.